Well, so I guess the question is to make sure that we know what we're paying for and what the real value of that is. And the people who really face that in practice, in many instances, alongside the clinicians, are the hospital managers who are left making a lot of the decisions on the ground, which seems to be an excellent point, Marianne, to turn to you and ask for your presentation from the perspective of managers who are confronted with these situations in practice. The floor is yours.
Thank you, Nick. Years ago, I listened to the radio, and there was an expert on etiology, that is the behavior of animals, who was speaking. And he was asked, is it possible to teach an old dog how to sit? Classic question. And the answer was, yes, it's perfectly possible to teach an old dog how to sit. It'll just take a bit more time than with a young dog, but it's perfectly possible. The tricky thing, he said, is to unlearn sitting with an old dog. So when we are talking about innovation, one of the challenges is that innovation demands new behavior and unlearning of old behavior. And I'm going to try to argue with you that we need two things to achieve that. One thing is that we need more knowledge on how to really achieve change. And the other one is that we need barriers to innovation to achieve real change. But let me start by the first one. I think we all accept the fact that there is a big gap today between what we know and what we do. And that gap keeps widening. It's not the creation of new knowledge, of new inventions or innovations that is the problem. The problem is making it happen. And I would like to refer back to the session before, and two things from that session. We heard Gary Howe talk about all the possible changes that we can do within healthcare today without any further knowledge than the one we have. And I think that points to the fact that innovation is not just pharma or medical devices, but innovation is has also got a lot to do with processes, design, etc. And the other thing that came up is the association to measurement. Performance measurement was the term used in the session before. I would like us to focus on performance measurement that measures outcome measures. If we want to achieve real change, we must form agreements on all levels of the healthcare system as to what it is that we are actually trying to achieve. What is outcome? And we need to agree, patients, professions, healthcare managers, policymakers, researchers, on what is the desired outcome. And we need to keep focusing and keep our eye on outcome measurements when we decide what to implement in the form of inventions or innovations and not. And we need to measure the amount of energy that we want to put into change by what outcome measures we expect to happen, and then we need to monitor if that does really happen. So outcome measures should be the guiding post for all of us within the healthcare system, and we need to agree upon what outcome measures we desire. I've seen too many times, and I've worked myself on exactly the same kind of changes that Gary described. I've seen healthcare systems improve their efficiency enormously. I wouldn't say systems. I've seen parts of healthcare, clinics, processes. I've seen enormous improvement in breast cancer processes. And 2 years after fantastic results have been achieved, and you come back to revisit, and you find that things are back in the way they were before the changes. I think everyone pays lip service to wanting these kind of changes, but it's not self-evident that all parts of the system work to support that kind of changes. I think that one of the difficult things of a complex system, and healthcare is a complex system, and as you know, one of the characteristics of healthcare system is the degree of interdependency. That is, what happens in one part of the system will have sometimes unexpected effects on another part. If we want to achieve successful change, real change, we need to understand how much effort and how much thought and how much dialogue across the whole system it takes to support successful innovation and make it sustainable. And to be able to put that kind of effort into achieving real change in areas where we know it will have positive effect on the outcome that we desire, we need barriers so that not just pharma industry, medical devices industries, but healthcare managers, policymakers, politicians are not allowed to become too trigger happy, if you'll excuse the expression. Everyone wants to put their mark in. Everybody has a vested interest in some specific part. Politicians want to gain the support of voters. The individual patient wants what is exactly best for them, not looking at the public health. The healthcare manager wants to survive and to keep on being a manager and deliver what is asked of him or her. The industry wants to make money. If all these in different levels are allowed to initiate innovation and change without effective barriers, nothing will be achieved, because we won't have the energy to put into the things that are really important and that we agree upon. We need to involve patients, professions, managers, policymakers and government in a much more active dialogue. I don't think that we have seen much good come out of financial incentives being linked to outcome measures. But there is still a lot of positive effects to be seen if we start using the outcome measures to an informed dialogue, where we can prioritize together, so that we can choose what interventions we really want to go through with, and together to focus on building knowledge on how change is really being delivered. I have a practical example on low level, working with patients in deprived areas who underuse healthcare. We started a dialogue, and one of the things that we learned from that dialogue was that the way we organize healthcare systems, with the use of telephone, with appointments by the hour and the minute, made it almost impossible for most of these people to use the healthcare that was free of service and delivered near to where the people lived. But for them, the way we organized it made it impossible. So when we changed to open hour clinic, where you can come without an appointment, and we had the clinics in times where you could go without taking leave from work, people started being able to use healthcare services. These kind of really small changes are not being spread, we don't learn from each other, we don't harvest the learning that's being done all over Europe. We need to create arenas and ways to work where we in the whole system work together, agreeing on outcome measures and prioritize what we want to put into practice, and stand behind the high barriers that we put up so that we don't start changes in reorganization, in policy making, in new ICT systems, in new devices or pharmas, without being really sure that they are worth the effort of trying to teach the dog how not to sit.